The visible catheter and pyelography. The visible catheter is employed to identify the position of stone or suspected shadows in the ureter and kidney pelvis. At present, two implements are employed, the one a catheter, the other a bougie, each heavily coated with bismuth paint. This metallic paint renders the catheter or bougie visible to the X-ray. Therefore, its introduction into the ureter identifies its position in relation to any suspected stone. Figure 31. Bugbee has shown that if the visible bougie is heated, it becomes extremely flexible and can be employed not only to identify the position of the ureter, but also to curl up in the kidney pelvis and show its shape and position. But we may go further than this and inject into the ureter and kidney pelvis a solution or suspension of some metallic salt visible to the X-ray, thus to exhibit misplacement and deformities of this portion of the urinary channel. This is pyelography, plate 4, also figures 36 and 37. Figure 33, numerous small oxalate calculi in lower calyces of right kidney. Plate 6, silent bilateral renal calculi. This patient passed a stone when 14 years of age. When radiographed, he was 63 and suffered from prolonged hematuria due to a small, scarcely visible stone, subsequently passed with relief of all symptoms, just below the angular stone in right kidney pelvis. The stones filling the left kidney had doubtless begun to form 50 years ago. Pyelography may be performed with a number of different solutions. The chief requisite is that the solution shall throw a good X-ray shadow and yet be fluid enough to pass in through the ureter catheter and out through the ureter. I have frequently employed argyrol in 30 to 50% solution, but the margin between a solution of argyrol so thick as to be muddy and so thin that it casts a very poor shadow is too narrow. Bismuth emulsions are likewise too thick. Color gall in 5 to 10% solution gives excellent pictures, but among the deaths that have followed its injection, some at least seem referable to poisoning from the color gall absorbed through the lymphatics and blood vessels of the kidney. 2 among the many substitutes suggested have proven equally serviceable in my hands. These: 1. Argentide emulsion prepared as follows: quince seed 100 grains, water 8 ounces. Macerate for 24 hours with frequent agitation. Do not crush the seed, strain through cloth. Add 2% boric acid up to 20 ounces. It is important to extract with water and not with the boric acid solution. Enough of this mucilage is added to 12.5 cc's of argentide to make 50 cc's, and the mixture is vigorously shaken for 2 minutes. The shaking is an essential part of the process. The value of this substance depends on the mode of preparation. It keeps for several weeks. This emulsion is irritating to the bladder, but not to the kidney pelvis. 2. 10% solution of thorium nitrate. Figure 36, normal kidney pelvis. Figure 34, renal calculi. They extend from the 10th interspace to the upper border of the 3rd lumbar vertebra. Figure 35, silent calculus filling the renal pelvis.